New rules are being put in place and medical professionals are being trained to deal with potential patients. First responders in Washington are going through scenarios if the dreaded call should come. Alongside that, new rules are being adopted across the nation, but officials fear new measures could discourage healthcare volunteers. The D.C. Fire and EMS Department held a demonstration and training session for first responders on how to treat Ebola patients. Officials say it's about taking quick actions from the moment they receive the call.
We have a plan in place right now. When you call 911, that's one of the questions that they ask if you present with the flu-like symptoms. Have you traveled in the last 21 days? Where have you been? So that starts the whole process right there. The key is communications.
These training scenarios emerged as states enforce tougher restrictions for people returning from West Africa. A mandatory 21-day quarantine or hospitalization already imposed by New York, New Jersey, and now Illinois is causing a heated debate on handling the possible spread of Ebola. In an effort to ease public concerns, the 3 states announced the measures for any airline passengers coming from West African nations hit hard by the Ebola virus. A mandatory quarantine would go into effect for travelers who had direct contact with an affected person. In a statement issued by the state of Illinois, Governor Pat Quinn says, in part, this protective measure is too important to be voluntary. In New York, where the state is already dealing with an Ebola case, Governor Andrew Cuomo says healthcare workers are ready.
The workers feel that they've had the training, they have the equipment, we've gone through the protocols, we've drilled.
In a statement, the CDC says healthcare workers volunteering to combat the Ebola epidemic in West Africa are heroes. The epidemic there will end without them, and without their work, the U.S. will be at an increased risk.
We do not have a vaccine, we do not have a cure, we only have treatment. And one of the things to understand, a virus is constantly trying to mutate, constantly trying to find a new host to live on, and as such, quarantine is the only thing that breaks the link.
Specifics in quarantine include anyone returning from certain West African countries have twice daily evaluations for 21 days, and Florida is the latest to enforce these rules. In the studio, I'm Yosina Banoop, WVUA News.